Good afternoon, everyone. Happy Wednesday. Thank you for joining us today for our panel talking about holistic approaches to end family homelessness. I'm Christina Pei. I'm Housing Up's Chief Development and Communications Officer, and I have three panelists joining us today that I'm very excited to introduce you to momentarily. I see some folks are just joining us right now, so give you all 1 minute to join. And as you're joining that, just a little bit of housekeeping. This webinar is recorded. So after we're done, we'll send out a link to you all. Feel free to share it along if you know anyone who wasn't able to attend today. And as we kind of progress through the panel, if you have any questions for me or any of our panelists, please feel free to just drop them in the chat and we'll make sure we have some time at the end for some questions from the audience. So with that being said, like I said, I'm Christina Pei. I am Housing Up's Chief Development and Communications Officer. Housing Up has been a nonprofit in DC for since 1990, and our mission is to build thriving communities for families that are exiting the homelessness system and otherwise low-income and vulnerable families. And from time to time, we like to kind of convene these panels and hear from other partner organizations, other organizations supporting families, and also some of our leading policy voices to get a picture of what is actually happening in homelessness right now in DC and nationally, how we're all kind of working to support families, and also what you as a community member can do to help this work. So today we are going to be talking about family homelessness in DC, current trends nationally as well, the work that Housing Up and DC Safe and other organizations are doing. Because we know there is a lot of news. There's so much news right now, and it's kind of even overwhelming for some of us doing the actual work. So we're going to try to bring as clear and up-to-date picture as we can, knowing that things change all the time. So with that being said, I want to introduce you to our trio of very experienced, very dedicated panelists. Up first, we have Malusi Adutum. Malusi is Housing Up's clinical manager and has been with Housing Up for about 2.5 years. Malusi is a licensed independent clinical social worker and supports our rapid rehousing program. She has a background in child welfare in both New York City and Washington, D.C., and she has a passion for working with families to help achieve stability by improving mental health access. Welcome, Malusi. Up next, we have Sharon McDonald. Sharon is a senior advisor to the chief policy officer at the National Alliance to End Homelessness, one of Housing Up's primary sources for information and advocacy and around homelessness. Sharon has been with NAH since 2001 and focuses on policy and program strategies to address family homelessness. Before joining NAH, she was a direct practitioner in Richmond, working for people experiencing homelessness. And she also has experience providing service-enhanced housing and a subsidized housing development for low-income families. Thank you so much for joining us today, Sharon. And finally, we have a repeat panelist. Michelle Sewell is joining us from DC Safe today. She is DC Safe's Crisis Shelter Director. Michelle has been with DC Safe since 2014, overseeing the Safe Space Crisis Shelter. Michelle also is in charge of all of the housing and community outreach programming that DC Safe does. Thank you for joining us yet again, Michelle. Welcome back. So I'm going to dive in and just kind of give a little bit of a very, very, very big picture overview on why we're choosing to have this panel today, why we're talking about family homelessness, and why we're all gathered here today. So if you follow Housing Up or just any of the general news, you know that family homelessness rose 39% in DC last year. And as always, when we're talking about homelessness, the factors for that increase are nuanced and multifactored. So first and foremost, the kind of chronic issue that always contributes to homelessness is the lack of affordable housing. We know that's a problem not just in DC, but it's a national issue. And then we start having, layering on top of that, more acute issues. So a lot of the COVID era assistance programs have all come to an end. Everything from the temporary eviction moratorium to emergency rental assistance funding, stimulus payments, all of those things that we're combining to keep families housed are at an end. And so as we see affordable housing continue to be an issue, the lack of that, housing prices continue to rise and wages are not matching that increase. So all of those factors combine to put a strain on homeless systems and the organizations serving these families. Um, a bit of good news is that we did see in 2025 family homelessness actually decrease by 18%. So it's great news in that, we kind of stopped the staggering increase in homelessness. And it's a testament to a lot of the great work organizations are doing and investments that have been made in housing and homelessness programs. Of course, with all the good news, there's always a but. And that but is that all of those investments, that funding, both in DC and federally, is uncertain right now. If you've seen anything about DC's fiscal year 2026 budget, you know that there are important cuts to important programs. Right now, and I think Lucy will talk a little bit about it later, but key housing programs like rapid rehousing are already on pause. It's a lot of talk about being right-sized, so families are not being admitted into those programs. And at the same time, we have a lot of affordable housing developers are seeing stalled housing pipelines, or in some cases, developers are backing out of affordable housing altogether. So we really have accumulation of various pain points that are leading to a lot of instability and uncertainty for the families that we serve. Now, having said all that, I'm going to turn it over to Sharon. That was a very, very, very big picture, Sharon, but you're deep in the weeds with policy at NAH. So can you give us a little bit more nuanced picture of, what is contributing to family homelessness and any trends that you're seeing nationally or in DC right now?
Sure. And honestly, you did such a brilliant job that I really have very few gaps. I think you just did a brilliant job there. We did see a huge increase in family homelessness nationally between 2023 and 2024. A number of cities like DC are reporting big declines in 2025, though all those numbers aren't going to be out. Prior to COVID, the numbers were really going down, and the numbers were going down, even throughout COVID because of some of the COVID era strategies that were put into place. There were the eviction moratoriums. There was a huge scale up of emergency rental assistance. There was also dedicated emergency housing vouchers that communities had, that some communities deployed to families experiencing homelessness or survivors experiencing homelessness. But beyond that, the primary cause of homelessness, very, very simple, is families' incomes are this, and the cost of housing is this, and the cost of housing is skyrocketing, and families' incomes are certainly not. And so all sorts of things can happen for families. There could be a domestic violence, there could be a lost job, there could be family conflict, there could be any kinds of situation that might precipitate the loss of housing, but it's not having other affordable housing or not having the income to reconnect to housing. That's the primary driver. So even for survivors fleeing domestic violence, the abusive partner can no longer be in the picture, but they can't afford housing anymore. And once they get into shelter, they may be ready to go back to housing, but they can't find housing. So really solving this disconnect is our primary job and our primary role. And one thing that you asked me to kind of hit on is just really the overrepresentation of Black families in family homelessness. And so, the most recent data is it's about 38% of all families experiencing homelessness identify as African American or Black. That is a big decline than in previous years, and that was because of the increase in families identifying as Latina or Hispanic. That's not that fewer Black families are experiencing homelessness, it's more Latina, and Hispanic families coming in the system and representing that. So more traditionally, it's a full half of all families who experience homelessness at a point in time identify as African American or Black. And that has a number of reasons, which I hope everybody is familiar with, including historical and generational discrimination in housing and employment and access to tools to predominantly housing to accumulate wealth, disparate treatment, and how systems interact with Black families and people of color, and social safety nets that don't extend to all people in equitable ways. And another factor, I mean, probably have a whole session on that, but another factor that shouldn't be overlooked because it's of critical importance. Nationally, most families don't come from their own housing that they were a leaseholder to. They come from a doubled up situation, and they were staying somewhere else, and then that relationship, that resource got depleted. And so it's not just the family's precarious incomes, but how robust is the social safety, the social network, and how much wealth or resources do those folks have? And so if you don't have as much wealth or resource, have been limited access, that you have fewer people to fall on or count on who can no longer, help support. And so when we see the withdrawal of stimulus payments and the advanced child tax credit and all the other things that kind of help families be resilient during COVID and avoid having to experience homelessness. It's not just their own, but their community network that created a buffer between homelessness and well, and housing stability. So I'm hoping I have probably rambled there a little bit off topic, but I mean, I think that speaks to the disparity. I think it's a good sign that numbers are going down. I do think that DC is in a unique position. I think a lot of
Yes.
communities are trying to get to where DC is, where they're able to try and help every family presenting for services with some sort of intervention to help them avoid shelter and quality shelter for every family that needs it, like what Housing Up is doing, and a rehousing intervention. Um, I think I can kind of go into more depth, but maybe
Mhm.
that's enough to get us started.
I
Unless,
know. That's a really great. I think I really appreciate making the point about the community resources, right? We don't just talk about families in isolation. It really is who do they have that is supporting them? Who can they fall back on? And that's also for a variety of reasons, many of them historical. It's definitely something that is kind of it's a factor in the overrepresentation of people of color in the homelessness system for sure. I was going to actually, you kind of touched on my next question. DC is unique, right? We have had historic investments in affordable housing development. We just do have a different system here than a lot of other big cities.
yeah.
So, what are you seeing in like cities like, New York or LA? And then also, we're going to be talking a lot about DC government and DC funding, but the federal budget and all of that. How do you, how is NAH seeing that trickle down to the families that we are serving and talking about?
Well, I mean, I think there's every reason to be worried, I guess. I don't want to be terribly alarmist, but e even in the best of times, we're not able to keep enough. So housing subsidies that allow families or people with limited incomes to go into the private rental market and pay 30% of their income has reached 1 in 4 of all eligible families. So there's just in the best of times, there's not enough of that. So even doubling that still leaves half the families in the nation out. And as the cost of housing increases, the cost of each voucher increases. So you have fewer vouchers when you have the same amount of money. So fewer families get served. So I think you have this stressor of a lot of families, not just the ones who end up showing up in the homeless service system, but a lot of families above and above and above, including staff and homeless service organizations that are struggling to pay for housing. And we don't have enough tools. So there are talks about cutting, the housing voucher program. But even if we don't have cuts, level funding isn't good enough. Even level funding it might mean fewer vouchers, which I think, as you said, Christina, is not just a pressure on families who are homeless, but it's a pressure on the housing market because we're in this interesting time when we have property developers who don't have enough income inflow. And so there's a gap in what families can bring to the table and what the property developers need just to break even. And so we need resources, and we need to figure out a way to close that gap. In addition, of course, there's homeless assistance funding, that we need increases on to keep up to speed. And then in the domestic violence space, I know that a big funding for shelter programs has been the Victims of Crime Act funding. And so that's money that gets regranted to states that can be used for all sorts of things, including shelters and advocacy and rehousing. And so I think, and that's not about appropriations, but that funding's been restricted. But so it's I will say it's challenging times. I will also say kind of trend wise, I think there's a lot of states and localities stepping up that are seeing, oh, this housing affordability is hurting us. It's hurting our economy. It's hurting how the city functions. And so there's just been a lot of efforts at fundraising or ballot initiatives. How do we get more money? There's been a lot more interest, I think, in prevention of homelessness and not just rent assistance, but getting, tenant advocates or getting legal representation for all tenants facing evictions, Black families, have the highest rate of evictions from that eviction database that folks have been contributing information to. So there's a lot of work, but there does seem to be some states and localities who are really stepping up and demanding more. And hopefully we can make it not seen as a bipartisan issue, but it's something that impacts every region of the country these days, even in places that historically have seemed affordable.
Thank you for that. I'm going to turn it over to Malusi. And we've been talking a lot about, the system and families in the system. Can you give us just a quick overview of, what do we mean when we say the system of homelessness? How does a family go from shelter to being housed, at least here in DC?
Oh, thank you so much. So, yeah, just a quick overview. Like, Sharon was talking about all these systems. When it comes to like on the local level in DC, families here, I'll start here. When families interact with this homelessness system, whether it be through outreach programs, service centers, or shelters, there is a decision assistance tool that is used to kind of assess their need, called the SPDAT. And so they have this trained staff that are able to administer these assessment tools based on observation, based on self-reporting from the family. And once that is complete, there is it automatically populates a recommendation for the family, whether the family needs like different lower levels of housing prevention assistance, whether they would meet the threshold for being matched to the rapid rehousing program, or if they have a higher level of need that is determined that they can be matched to like either targeted assistance housing or permanent supportive housing. And so that's kind of how they start matching into those programs. And with the rapid release housing and then the shorter term like transitional housing programs, those programs are designed to kind of provide like an immediate type of assistance, a short term, so rapid as 1 year, where whatever the barriers for that stable housing have been presented, whatever those are, we can work with the family for that period of time to kind of meet those barriers. And they can exit successfully, whether it's to that independent living or if some people end up moving out of state and recognize that it's just, like we've touched on before, the affordability of housing in DC is is really hard. So that's just generally the overview of how the housing system in DC has been so far.
Okay, thank you for that. And so my follow-up question, of course, that's how it should work, right? And we know that's not how it does work. So can you talk a little bit about the specific work that you do at Housing Out with Families and what kind of you are the challenges that you're seeing now that maybe we didn't have a few years ago?
Yeah, absolutely. So looking at say for example, for a family that gets leased up into one of the units and they're assigned to housing up, in rapid housing, our case managers are re-administering that for that because we want to see where the families are when they get here, whatever the barriers or the circumstances that kind of brought them into the situation. We want to be able to assess like what changes have been made even between that time. We re-administer that also every 90 days. The case managers, they do a great job of trying to get as much information and like being able to assess the needs of the family at that time. So using that holistic approach, kind of looking at the parents, the children, or whatever dependents are in the home. What are some of the needs? Is it an educational barrier? Is it an employment barrier? Is it a mental health barrier? Like, was the housing an important piece that they needed in order to address their mental health or substance use? Or was there like the domestic violence piece that we've touched on before that, how can we service the family and connect to the appropriate resources that way they will find their way into stability that we can exit appropriately. Now, while we're doing the case management in a 1 year time frame, things happen. We come across different concerns, some that may not have come in for as a result of a domestic violence situation may find themselves in one. And so in that time, like assess, we do the consults, we refer out to DC Safe if we need to collaborate with our victims in order to kind of get those housed. We work with families if it's an educational piece or employment concern. We have an employment specialist that works with them one-on-one to be able to assess, like, is it a resume support or do they just need support with getting access into the job market and that like entry in order to start making how much they can make in order to be stable. Are we looking at childcare barriers? So we're really assessing the whole family to try within the time period that we have them to address all of those needs in order to ensure that once they exit the program, there is not that repeat of the cycle. But that, of course, does not always happen.
Sure. Yeah, I'm gonna ask a couple of questions, Michelle, but I will come back to you, Lucy. Thank you. Awesome. So Michelle,
Absolutely.
I mentioned before that of course you've joined us on panels before because as Lucy and Sharon have both spoken about, you can't really talk about family housing, family homelessness without acknowledging the contributing factor of domestic violence. So I think since the last time we talked to you, I know DC Safe was seeing an uptick in DV issues. Housing Up saw that same uptick. It's been a couple years since we last talked. So, what's going on right now in DC Safe and the community in general?
I think as we were all talking here, when we see a disruption in the community, be it financial, a pandemic, a crime situation in a particular neighborhood, we also see it downstream for us and the reported number of domestic violence incidents being called in either directly by the client or MPD or Housing Up or one of our other partners in the system. Where you're stressed in one place, that stress shows up somewhere else. And often the other piece we're also seeing is as housing stock goes down, housing support monies go down, like which is what we're experiencing right now, this disruption, folks I self divert to other houses. They may go back to a former abuser or a family member who was abusive or just a chaotic housing situation. And that also creates a domestic violence situation for them. So anything that disrupts the system as they know it, maybe their lives were going on pretty well, and maybe they got an exit note, or they lost their job, or a new baby was born into the house. Anything that disrupts how the ecosystem was sort of normally running, that's where we see the uptick. It's rare. There's just a spontaneous domestic violence event. The system has been building up in pressure, and then it explodes. And so now, as we see this financial crisis through federal dollars and DC making some hard choices on a local level, we're seeing our phones ringing again. So my shelter was at a particular census 7 days ago, and I walked in and it had just bloomed. And a lot of those cases are around a disruption of housing, either fear of losing the housing, a baby was born and there's a crisis there, or they no longer could stay where they had self-diverted. So DV is one of those sort of canaries in the coal mine, as they say, when something else in the system shifts around.
Absolutely. So, talking about DC issues, government issues, the work still continues, right? We still are serving these families. So, in a time where it seems like even our providers, our governments are not exactly sure how to move forward, how are you changing how you're talking to clients? How are you better preparing them to be a little bit protected from instability that actually doesn't even have anything to do with them while they're also navigating their own personal instability?
Right. The best time to be, well, they say plant a tree was 20 years ago, and the best time is right now. The 10 years I've been working here at DC Safe, we've been um, establishing and broadening our partner base so that when crisis moments come around, we're not being reactionary. And so there are partners that we've been putting in place throughout the 10 years I've been here, and DC Safe has been around almost 20 years, so well before my time, that when the system changes, we are having like-minded conversations. We're not being caught on our back foot. And so we can sort of know what's coming downstream, and we're not just sort of discovering it maybe as like the general community would be finding out. So we've sort of kept our ear to the ground, as it were. So as we heard that the financial shifting was happening, as we heard some of the subsidy programs in the city were uh, pausing. We then started collaborating with partners and also talking with staff here and saying, here are the kind of calls you're going to start getting. Clients who are losing their subsidies, being told they're being exited from those financial supports, and now they'd have to cover the 100% of their housing. And that's going to create a chaos in the system. We're having really transparent conversations with our clients. Many of our clients are clients who've been our clients for many, many years. We're keeping their cases open longer, where we are a crisis agency. We get in, we discuss the DV event, we put those remediations in place, and then we just step out of that person's life and let them, go on. Here we find ourselves around, especially around the housing piece, staying connected to the case longer, doing more warm handoffs to case managers, talking to more agencies who are funding their stay, and trying to problem solve out what can be some next steps. There are hard decisions being made. Some of our clients are choosing to leave DC. So our emergency financial assistance program is helping people relocate. Is it down south? Is it back to West Coast? Are you going to New Jersey? So some people are leaving. As we know, the housing market here is super expensive and they just simply can't do it here. And so we're looking at a lot more I guess, difficult choices, but choices that we can support through our EFA program. I think that clients, they know what's going on. They may just need some guidance around it. And so we're just having those harder conversations and what is practical right now. And the decision you're making right now might just be a bomb for now. And then can we do something later down the road? A lot of our clients are moving back in with their parents, with their kids. That's hard. Sometimes we support a family who's willing to take a client in. We might pay the Pepco bill or send food supports there, diaper supports, something else that will sort of take the stress out of the system. And because they're willing to let the client and their child move back in, or just the client themselves move back in. So we're just having these really upfront, hard conversations. And we're just, again, keeping our eye on the local community, what's shifting, so that we are prepared for what's coming towards us.
Sure. I actually want to ask the same question to you, Lucy. You've been with Housing Up, what, almost 3 years? So are you finding yourself having different conversations in 2025 than you were a couple years ago with clients?
Yes, actually. So similarly to Michelle, when I first started at Housing Up, we had a lot of options. I don't say so many, but we had some options for families, specifically those that we've identified to need higher levels of care, and that they would need like more a permanent, long-term case management support, et cetera. And we were able to case conference them And that case conferencing through the same cap matching system, um, few and far between. We didn't get a lot of options, but not everyone will be able to be case conference into that matching process. But we did have that as an option, as a resource. We did have the more permanent supportive housing vouchers that were available for those clients that needed that higher level of need, whether it was a mental health reason or a physical disability barrier that kind of restricted them from being able to work in a way that they can sustain their own employment and their own housing. So the conversations now over the last several months, specifically since the district has been exiting a lot of families who have been in the program a longer time due to all the COVID area protections. So they have started and have been exiting several hundreds of families since last summer. And so the conversations we're having with our case managers and that they're doing a really good job of having with the clients is that there isn't a lot of housing options. We need to actually work on a plan, whether that means that whatever employment you get, we need to really look through your budget and your finances and what can you tangibly afford within DC. And, you know, the subsidy program is only 1 year. So when you do exit, you are responsible for 100% of your rent. And all of that comes with it. And so what does that look like with your, you know, speaking to the family, with your finances? Are there supports? We're trying to explore what other familial supports, community supports are present that you can take advantage of in order to maintain your long-term housing. If we need to, and you haven't already been connected to like SNAP benefits or TANF or Social Security, maybe that is something that you qualify and weren't aware of. So really having those like very transparent and honest conversations about what is actually available. Because historically within the district, within the housing program, there have been a lot of vouchers that have been available and people are aware of that. Clients are aware of that. Well, there's this voucher that so-and-so had, and that's a different time. So we have to have those conversations with them. Like, that's a different time. We're in a different space right now. As of today, we don't have those options. We just matched our last three tenant-based PSH vouchers earlier last month for the year. So that option is off the table. We haven't been able to case conference since last June. And so those clients who we've identified that need that higher level of care, we've had to outsource and collaborate with, you know, possibly DBH partners and core service agencies and explore like, hey, what options of programs do you have that we can maybe, if we have to do the warm handoff to that agency in order to support the family with that long-term stable housing subsidy or voucher. Like, those are some of the things that we're having to do. But the underlying conversation is those things are not guaranteed. That's not something that I can guarantee and promise you that this is going to happen. We can explore, and that's all we can offer. Like, that's all we can honestly say. We can only explore those options if they are available. And if not, what is the plan? Like, do we need to go back to school to get additional like experience in order to get a better employment? I know DHS just last year they launched the Peer Case Management Institute. So that is something where they've had individuals who've experienced the homelessness system, and they are looking for that pathway into a more professional job space. And they do like classroom work, they do on-the-job training, and I believe last year they shared that about 38 of the 40 participants were able to secure employment within either as a case manager, employment specialist, those family coordinators, those type of roles. So that is the pathway that is afforded that the DHS is exploring. We, Housing Up, just hosted 3 this past year, this last month, and they just finished on Monday. And so we weren't able to offer the extended employment, but we have helped build some skills that they can utilize to kind of open up that world of professional employment. And it's not just cashier work, or which is important, but those careers paths don't always open the most doors in order to get, you know, that stable housing. So those are some things that we've been able to do thus far, but those conversations are had. And even with those students, we've explained to them, and they've seen on this end that we have but so many options. So, just understanding both sides of the story, that has been helpful.
Thanks, Lucy. Yeah, I mean, I think it's definitely a level of transparency that is needed and heightened. Definitely, obviously, the conversations you're having with your clients and people that you serve, but I think even, and as an organization, when we talk to our donors, when we talk to our community, we are definitely more transparent in our communications this year because we have to be. I mean, there's news that we know, and then there's news that's speculated, and it's always very important to kind of make sure that we're not dealing too much in the speculative when talking to anyone in our community. Just kind of want to open it up to all of you now, kind of along the lines of transparent communication. What is one thing that you think, not advocacy folks, not people doing the work, but the one takeaway that you want people to know, the one fact that you want people to know and really kind of absorb about family homelessness, about DV, about where we are right now?
If I could add, and I think we talked about this when we were sort of doing our briefing, to start having transparent conversations about how the District of Columbia is changing and programs that existed and have existed in memoriam don't exist the same way or are being eliminated altogether. And folks can't depend on historical programs that maybe have helped previous generations in their line help them sustain, move on, excel, right? It appears the district is changing their priorities and where they want to put their monies and who they want to invite into DC to spend their monies and travel here for tourism. And they have to factor that in to how they're making some of their life decisions. And that they're going to have to be at the helm of their lives a little bit more and have less sort of intrusive programs because once those programs start to collapse or lose funding or go away, um, they're the ones who are going to suffer the most, right? Because people will refashion themselves somewhere else, maybe in their own career, but those fundings and those resources are going to be gone for that family. And so really talking about um, how do you sort of elevate yourself out of needing these services over time as well? And I think that's a hard conversation when people feel overwhelmed by everything else that's going on. And those are valid feelings.
Absolutely. Sharon, what about you?
So this is tough because I guess so the homeless services world is full of people who are pragmatists, and what you heard a lot of conversations around is how are we going to try and stretch resources, and now we got to do this, now we got to try and do this, and the cashier's job isn't going to be enough to pay the rent, and it's a little bit heartbreaking actually. And I guess a couple thoughts. It doesn't have to be this way, you know. I think we have a history of starving families, and we don't have to, and we shouldn't, and we should have a more just system. I think maybe, so we need to support, which is an advocacy position. We need to support families and reasonable incomes and making housing more affordable and figuring out how to create win-win relationships with housing developers so that they get what they need, but our families get what they need. I think here's something that just resonated with me that has always sort of stayed in my heart and hurt me a little bit is the blame that sometimes I think women and families internalize about their situation as if they've done something wrong, and they have not done anything wrong. They have not. They are striving as hard as they can. So they internalize that. They internalize that from other people. And I think we're shifting also to a world that's a little harsher to people who are poor, and need to figure out how to push back. And I think people are questioning, well, you didn't solve this issue that I didn't give you enough money to solve. But people know, people around here, housing help, what I'm hearing from DC Safe, you know how to get people back into housing, and so I think the interventions, people know what to do. They just need the support and the resources to actually do it. So that's what's sticking with me now. And I guess I'll also say I've just also recently encountered um, a volunteer group, and I just saw the power of volunteers to really augment what people are able to do. And I think we're, at least in my little world, we haven't been paying as much as attention as to what they can bring to us. At the Alliance, we haven't been, not just as actually doing the work with people, families, children, single adults, but also as potential partners in educating policymakers and their neighbors about the solutions that they see firsthand works. That's what I got.
It's a really good point. I think one of our buzzwords this year has been community in all the ways because it really is, we're all connected. And I think the more the people that are educated and knowledgeable outside of the organizations, outside of NEH, it can only do good. It can only help. Lucy, did you have anything to add to that kind of key takeaway?
Yeah, yeah, actually, as Michelle and Sharon were both talking, I was kind of reflecting back on the case management institute that I just mentioned, and I think one of the key takeaways I would say that individuals and families and even staff that are working with clients can to really empower the clients to that they have a lot of resources that they can tap into. Specifically thinking back on those students, those with lived experiences know how to access certain things that we may not have information or access to. And the DC area is very robust with a lot of, small communities that are doing this, that like food drives or backpack drives or fairs. And I think that really encouraging clients to like look through and kind of rebuilding that community, the sense of community that there are people that I can support. Your neighbor may have a license for daycare, and that way you may be able to have, that childcare that you're looking for in order to go back to school or in order to go get that job and whatnot. So really encouraging the clients and individuals to just be able to look within their own communities because like it was said before, a lot of these programs may not be here and we may not be able to keep referring to this mental health agency which closed down or this agency that has been able to work with utilities assistance or whatnot. And so really just kind of looking within the community and really empowering individuals that there are resources that they have access to that they have within themselves that they can also pull on. So just wanted to add that piece.
Yeah, it's a really good note, Lucy. Last question before we open it up to any audience questions. Is happening right now? Anything positive? Any glimmers, sparkles of hope that we should be sharing? And if not, there isn't.
I
Um,
mean, I'll point to all of you ladies as glimmers. I mean, it's just really wonderful. I always get, I don't know, fueled up by seeing people doing the work and seeing the kindness and smartness and commitment and yeah, and always figuring it out. It's a great, the homeless services community is a great community of people who just continually roll up their sleeves and just work harder to make the world better. I just appreciate that. And yeah, and I do think people are working at the local level constantly. And there are glimmers there where, state and local leaders are saying we need to do more.
And I think, in all the ways we're concerned about the shifting that's happening, DC remains resource rich on multiple levels, just not on governmental, local, micro level communities also have, as what Lucy said, has sort of figured it out. And let's keep being creative and listening to our clients and figure out what they're tapping into and how we can support that. We have a lot of clients here at the shelter now who are really looking into SROs and interesting roommate collaborations and how we can support that, even if we can just pay the security deposit, if they're now outside of the sort of traditional housing format as we know it. And so just keep listening and figuring out what people are also creating for themselves.
Yeah, and I also wanted to, I mean, it's been a lot of talk about a lot of programs not existing, but we were granted the opportunity to match several of our clients to the Housing Choice Voucher Program. And so, especially particularly for those who have been in the rapidly housing for a number of years and were due to exit last year, we received notice from DHS that they had a set number available to those families who qualified. And so we at Housing Up were able to match about 50 or so of our clients to that. So they're being at least have that support and being able to exit, but with something concrete in hand to help support with their stability. So that is something that it may not be very long. We are no longer able to offer that to other people exiting, but we have been able to offer that. And that has been quite a breather for a lot of the families that we've been working with.
Yeah, that is great news. If you have any questions, drop them in the chat now. I responded to a few that came through while our very brilliant panelists were talking. But we'll leave it open for a couple more seconds. If you have any questions, get them asked in the chat. And like I said, this recording will be sent out and we'll be following up with an email for all of you who attended. But thank you very much, Sharon, Malusi, Michelle, for joining us today. Definitely urge everyone listening to follow NAEH. That's the National Alliance to End Homelessness. That's where Sharon works and Sharon's organization. They are kind of one of our go-tos for information and advocacy directives. And also do follow the work that DC Safe and Michelle are doing over there. They are doing very important work in our community. And if you're not already, of course, obviously follow Housing Up and see some of the work that Mabusi is doing. So thank you all again for joining us today. Enjoy the rest of your week. Okay.